Hi, I'm Diane Hullett, and you're listening to the Best Life, Best Death podcast. Today, I've got a really neat guest. This is Ashley Bright. Hi, Ashley.
Hello, Diane.
And Ashley and I met through the Conscious Dying Institute, which is now called the Conscious Dying Collective, where Ashley is on faculty. And she lives in Tennessee, and she's got all kinds of things to offer in terms of what she brings to the experience of end of life. And today I really specifically wanted to talk with her about this term advocacy, an advocate. You know, what does it mean to be a medical advocate? What is a patient advocate? How do you, my listeners, tease out what these terms mean and come to understand how they can help you? So welcome, Ashley. And just, start off, tell us a little about yourself. How did you get into this field of work?
Sure. So I am an end-of-life doula and started out actually in the healthcare arena there. I'm a social worker and I worked for several years in a skilled nursing facility here in Nashville, well, north of Nashville. And just came to realize really that sometimes I would have patients and families who are brand new to being in this kind of healthcare system. And when we say system, once you kind of enter that through when you're a certain age and you have some illnesses that just kind of keep you going back and forth, from the hospital to skilled nursing to home, and then maybe you're going to be looking for care after that. And it's just kind of a whirlwind of information that hits patients and families all at once. And as a social worker for these patients and families, I was noticing a lot of confusion and just a real need for more guidance that extended outside of the facility where I was working. And I was thinking, I really wish I could help beyond.
Yeah, that makes so much sense. Like it's just kind of a maze to navigate. And the funny thing is, until we have to navigate it, we've never navigated it. And then all of a sudden, there you are thrown in. So to have somebody who can help with that and guide with that seems huge. So you kind of took social worker skills and end-of-life doula training and put them together.
For sure. And so I do have a business where I do healthcare navigation and advocacy. And my business partner is a nurse. So she's been an LPN now for 30 years. And so I feel like combined with nursing and social work, we're able to provide a lot of resources, for families here in the area.
What phrase do you use? What do you call yourselves?
Well, that's interesting. So we're trying out several different things because you just never know what's going to speak to the community. Where is your community at when it comes to receiving information? So we mostly use healthcare advocate. Case manager is still a little clinical and doesn't really fit who we are. But healthcare advocate or healthcare navigator is something that we use a lot for that.
So in different states, like somebody might Google healthcare advocate or they might Google patient advocate. Is it common to have people outside of the system, like you and your partner, who can then help navigate within the system?
I think it's becoming more common as people are seeing that it's with Medicare regulations, healthcare regulations, and the overwhelmingness of all that information, they're seeing that they do need help. I was looking around because you had asked me, like, where can somebody go to find this information? And I found that a more universally known term is geriatric care manager. That seems to be, when I Google that, then more names come up. But again, it's kind of like an end-of-life doula, right? So I'm an end-of-life doula, as are you. But I have a lot of those here in our city who say, well, I'm an end-of-life doula. I'm an end-of-life doula. We've all got these titles, but I separate myself by saying I'm a sacred passage doula because I did come from the Conscious Dying Institute, and that is what our certificate says. So when you're a care manager, you can also have different types of certificates within that realm, and that's what you call yourself, So where do you go to find an end-of-life doula? Well, that's hard. Where do you go to find a care manager can also be hard. But there are places where you can go if you just have not heard any word of mouth, this person can help you, well, we've got a place to start.
Which is what? Which is
Mhm.
geriatric care manager.
Well, what I would do, first of all, is so each state has an agency on aging and disability. So it's AAAD, and they provide resources. And so I did find that there is a website, the eldercare.acl.gov, and I'll send that to you if you want to,
Yeah,
put that
elder
on your
care
blog. But
AC.
eldercare
Okay.
.acl.gov, and then it's got some links that will take you to your state's area agency on aging and disability, so AAAD, and then you can look for resources there. And I did find geriatric care manager type services on there. So if
Right.
nothing else, search for the free directories that are available to you through the AAAD, and then also we have one in Tennessee called Age Well. That is a free directory. And then there are some other paid directories for aging services here
Terrific.
also.
And I
Yeah.
was just laughing. I was talking to someone yesterday who listens to the podcast, and she said, I often listen while I'm driving, and I always feel like I have to pull over to write stuff down. So just know that we'll repeat all that at the end. And then I think I'll also be sure that it's written wherever the materials for this podcast appear. We'll put that in the write-ups.
Right.
And find it. That's great. So, okay. So say you find a couple of people, or you find a person, or you hear from word of mouth, hey, my family used this person. How do you even begin? What do you ask that person about what they offer?
That's a good question too. So, I think that you just need a place to start. So sometimes when you're thinking about things that you need, you don't really know what questions to ask or where to start, because you just know, hey, I need help. And so a lot of people who are healthcare navigators like me, we do offer, a 30-minute free consultation, just to see, is this something that we can help you with? Is it something that can be answered in one question or two, questions, and then you just go about your business, or we make you a couple referrals and you're done. So something that everybody wants to know, of course, is who pays for this service. Well, this is going to be a private pay service. So if you're interviewing some different companies, you might see which one fits your budget. You might see if one offers a sliding scale or something like that. So, who pays for this? And then also, what is it that you can provide to help me? Do you take me to the doctor's office? Can you sit with me there? Do you provide just a list of things that I can do, like a care plan that I can follow myself? Do you offer to walk me through that care plan? Do you offer some of both? What is your level of handholding, I guess you could say, through this experience?
Yeah, good. I love that metaphor, because that's really what it is. It's like you probably, as the family member or caregiver, are walking this for the first time, and you're looking for some handholding on what makes sense. And that's so great to know that a lot of people do a 30-minute free conversation, because as you said, it might just be getting the phone number of a resource, and you could get that quickly, and that's really all you needed right then. Or it
Which I'm
might
happy to do that. Yeah.
Yeah, or it might be a more complicated, as you said, a care plan, and then a care plan that they help you walk through.
Mm-hmm.
Ashley, how did you what drew you to this kind of work?
Just that level of confusion that people have, and just noticing, I was hoping through my end of life coaching certificate and things, like, okay, I'm going to be an end of life coach and an end of life doula, right? And I have this skill set and this passion, this drive to help people really figure out what their healthcare goals are. But a lot of people weren't ready for that yet. They're still figuring out where they are in this healthcare world. Let me just get through this treatment and this treatment, and then we'll talk about, when all else fails, and I'll call the end of life doula. Well, what if we back that up a little bit? So we were thinking we could be better utilized or help people to be coached through what their desires are for their health or for end of life, if we back that up and help them while they're still trying to navigate.
Right.
And so since I do come from that background, and so does my business partner, then it was just a natural fit to back it up a few steps and enter it in a different zone.
Yeah, I remember somebody was just telling me a story about meeting a couple where the gentleman was clearly dying. I mean, she said, you met this person and you knew that they were at the end of life and had been very ill with a terminal illness. And yet the couple was still saying to her, oh no, we don't need a doula. And he died, a week or two later. And they just weren't ready to take that phrase as being applicable to them. So I think you're right. If she had been introduced as a healthcare navigator or as a support person for, I don't know even what the phrase was comfortable for people. I mean, this is the interesting thing, right? We have such a challenge facing our mortality, even when it's really right in our face, that it's hard to get the help on board that can really help us walk that. So how do we rename it so that people are comfortable saying, oh yeah, that applies to me. Healthcare navigator, that's what I need. When really it may be the skills of an end of life doula that you're primarily bringing.
Well, and you have to have a mindset, an open heart, and open mind as an end of life doula to say, um, culture may not be ready for me yet, or my community may not be ready for this concept yet. And so when you grab that certificate as an end of life doula and you run out there in the world and you hang up your little shingle, it's like everybody's going to come, because I have this thing that everybody needs, but your community is still. So what do we talk about when we're teaching new doulas or coaches is that this is truly a culture shift, and you're trying to turn a giant cruise ship around, and it's slow. It's a slow moving thing, still important work. So how do you meet people where they're at, which is a very social worky term, meet them where they are and help from that point forward. And eventually you may get to where you are talking about end of life, or what are my real goals and how do I define what those goals are. And so if I can meet you where you are by saying, I'm just here to advocate for what you want, then that might be the most helpful.
Yes, I'm struck again by this word advocate, because I know in my personal experiences of, my mother-in-law being hospitalized or father-in-law, there is this level of having to show up. Somebody in the family has to show up like morning after morning, talk to doctors, find out what's happening, explain. Oh gosh, with my mother-in-law, there was this tender moment where she was having this terrible back surgery, and we realized that the hospital staff saw her as this crippled old lady. And we
Yes.
knew that she had just been in Spain walking around 2 months ago. So we ended up putting pictures of her up and talking to the staff and almost advocating emotionally for her, like explaining to people, this is a super vibrant, active person. Like this crippled person in the bed who's in so much pain is not who she is. And we want to hope this back surgery will get her back to where she's got more of that vibrancy. So point is, there was a huge amount of family advocacy that we were there being her advocates. And I often think, what about people who don't have that? Or
Mm.
their beloved partner of 65 years is too elderly themselves to be that kind of proactive advocate. So I think the word advocate can apply to family members, adult children, grandchildren, whoever can step in, even dear friends, partners, of course, sweethearts. But then there comes this level of when that support system needs support or that support system isn't there. And so how do people navigate the system with some degree of competency? And sometimes it's calling some professionals. And I think this thing about what are they called and who are they and how do you find them is a really interesting one, because I think when you're discharged from the hospital, you're supposed to have a social worker kind of talk you through what's next steps. But I don't know if that always happens in the way people need or to the extent they need.
That finding those next steps from the hospital or from skilled nursing, yes, because it can often, like as I was saying at the beginning, it can end there. So if I'm your social worker in skilled nursing and I hand you off to someone else, I may never see you again. I may never know what the outcome is. And going back to what you were saying about how a elderly person can be, or a sick person can be talked about or looked over and not talked to. I mean, I don't know if you know this or if your listeners know this, but even something as simple as an infection like a UTI or a like pneumonia can really give an elderly person some altered mental status is the, to be clinical, but really what that is confusion.
Yeah.
That infection has made them confused when, like you said, 3 weeks before they were traveling in Spain. So the family may say, this person is not, this is not their baseline. They are normally very with it, and we should be involving them in this plan of care and in the conversation, even though they might seem confused, but you never know what they're really taking in. But having those pictures up and things like that, like this is who they are, as a reminder, because, staff, as caring as they try to be, and that person-centered care that they are really shooting for, sometimes in the busyness of things, it's just like, oh, this little poor lady, she's so confused. So, and also coming into the healthcare system for families can be intimidating. So you might see a doctor coming in and you want to try to advocate, but they're maybe talking down to you or speaking in clinical terms that you don't quite understand. So you're right, having that next level of in between navigation, even though you're doing a great job as a family member, keep doing that thing. And as end of life doulas, what do we say? We're here to educate families on how to be there for their family member. Same thing for an advocate. We are educating that family on how to step up and what are your rights as a patient and as an advocate.
Yeah. Yeah. That's so powerful and so important. And I always want to acknowledge too, and it takes so much time. It takes so much time. And so, you've got a full-time job, you're working, you've got kids, you're trying to make dinner. It's really something to try to navigate these places of health.
Oh yeah, because oftentimes when you're stepping into this role, you're kind of thrown into it. And that's kind of where a lot of my clients do come from is if you can just imagine um, maybe being a friend of a person, and all of a sudden you find yourself in this role of advocate for a friend, and you've got your family over here that you're taking care of, and you're working your job, and you're like, I've got this friend now that all of a sudden I wasn't planning on, caring for, and I love this role and I love this person, but I'm just kind of out of sorts and I don't know where to start. Or um, I've had a very young person in their early 20s who found themselves in that role for two grandparents, and she's young and she's got little ones at home, and um, that's another scenario where it's like, okay, I've not really had any time to ease into the thought process that I am now caregivers for some very ill adults and I don't know what to do. And family is trying to help the best they can, but as you know, just the busyness of life. So call a professional. That's kind of one of my favorite lines that I tell even students when I'm teaching doulas is, if you get stuck, call a professional. I mean, don't try to do this on your own.
Right, right. It's my husband said one time, he said, there's all these skills that come into play with an aging parent and the death of a parent that you never had to learn before, and you don't really need them again until something like that happens again. But it's a huge skill set that is like this tsunami that we're not prepared for. We just get hit by all the capabilities that are required. Yeah, there was this funny moment. I think I've told this story before, but when with the back surgery thing with my mother-in-law, Russ educated himself so completely about it that one day he was talking to the doctor one of these early morning rounds, and the doctor said, "Now, are you a physician yourself?" Russ always joked, "No, I just play one on TV." But, it was like, that's the level that he had to get to be able to talk their speak about the L4 and the L5 and the, possible what they were going to do. So very interesting. And most people aren't able to do that or don't want to do that. And so call a professional.
Very true. And the whole reason that I even got into healthcare, honestly, my background is in insurance. I was an insurance agent for a while, and before that, I worked for a nonprofit. So, how did I end up here? Was I was caring for my grandparents, so I was their power of attorney, and they were in assisted living. Grandmother had dementia. My grandfather had end-stage kidney disease. He was on dialysis. He was very with it, but just couldn't do anything for himself. And on top of that, he just had a lot of other comorbidities that required lots of specialists. And so, yeah, I had to teach myself some things too. And I was a social worker. I had my social work degree, never had used it until I thought this is where I need to be using that. And so I went and got my master's and said, okay, I need to help other people because I feel like this world, it's taken me 8-10 years to figure things out. So what if somebody else doesn't have that kind of time, and they could really use help?
Right. Or just how do we disseminate the information? How do we make it simpler? I was talking recently with Suzanne O'Brien of Doula Givers, big doula training program. And she said that they are really shifting their doula program to create multiple tracks of doulas. Right. And so there is the sitting vigil with someone who's dying doula, but there's also elder care doulaship. And
Yes.
I loved that. I thought that was really a good way to kind of tackle this, exactly what you're talking about.
Oh, yeah.
You say, I'm a doula, how can I help you? And someone says, oh, I don't need that kind of service yet. So yeah.
Oh, we also have that here in our town. We have a woman who is a gero doula. So she helps people through the system. That's what she calls herself. And then we have one that's a dementia doula. So, a doula is non-medical support. So there's not really any category to put us in. And so we've been using that term. And so maybe at some point the doula term will be more widely recognized and we can put different qualifiers on that.
Oh, I love that. Yeah. That a doula is non-medical support. That's just
Mhm.
such a great way to put it, and can offer guidance and education, which,
Right.
it's funny how I think sometimes people think they need like the technical support, but really a lot of times what they need is a hand holding and some information. And it's not as detailed as they might think. It's really this guidance.
Guidance and organization, because like I said, when you're caring for your own household and then you're caring for somebody who is ill and they've got all these specialists and things like that, that's when it starts to become, okay, who pays for what? What about longer term care? What about Medicare? What's the difference between Medicare and Medicaid? And who pays for assisted living? Who pays for rehab? What if they have to roll in? It's all this information that it's not just um, what type of care do I need, which is a lot of it. That's one of the things that we can come in and assess. Is your loved one ready for a nursing home? Or is there a least restrictive environment? Can they make it in assisted living or independent living for now? Or can they just hire some caregivers to come into the home? What's the best way to age in place for this person, which is always my goal. The less shifting around that you can do when you get into your last years of life, I think the better. So not only is it where should my loved one be, but who's going to pay for this and how can I prepare?
Yeah. So these are the kinds of questions that you talk with people about and bring to the table and bring to the forefront so that it's not, just a giant mess.
Yeah, exactly. So you were asking, what are some of the things that um, we ask? What are some of the things that I would want from you if I was going to navigate for you? So, of course, I would want to know, well, do you have paperwork in place? Is there a power of attorney? Do you have a will? You know, um, have you done the work on what your wishes are? Sometimes, like here in Tennessee, we have a healthcare advocate or healthcare agent form that has kind of taken the place of the traditional power of attorney. It's just a front and back, and you can name somebody to be your agent. And then you can check some check boxes that say, this is what I want and don't want. So do you have that kind of paperwork in place? Or if not, how can I guide you to do that? What's
Right.
your budget like? Things like that. And then we'll talk about what level of health are you? What specialist are you seeing? What are your diagnoses for now?
Right. What are your needs?
Yeah.
Yeah. Yeah. That's great. That seems like such a huge, huge service. I just think of the number of people I know with aging parents who need these kinds of support services. And often it's happening out of state. That's a whole other thing.
I've done that. Yeah. So when I was talking about, somebody young and having grandparents, and I'm thinking about one that had to bring the grandparents from another state to this state, and so all the logistics that were involved in doing that, because yeah, when you've got Medicare or insurance, you got to transfer all that over, and wow, it was such a web that we worked through, but we got through.
In your experience, when people contact you, is there like usually cooperation among family members, or sometimes are the elders not happy about all this?
I think that just it I guess backing up, so personally here in this business that I'm doing, the elders are very appreciative. I mean, they have really they appreciate that their family is trying to help them. They appreciate that there's somebody there helping their family member, through this. I've certainly seen through working in skilled nursing that that can be an issue sometimes, when that loss of independence, you start having to those feelings. I've been my own agent. I've been my own person for such a long time, and now I've got family that's coming in and trying to tell me what to do. So to me, I think we should incorporate the coaching of that, um, with families to understand where their loved one is coming from when that's happening. They're not digging their heels in, but it's that loss of independence, um, that's driving their fear, and so a lot of times they don't want to sign paperwork. And so how can we work around those kinds of things? That might be difficult. So um, sometimes you have to tiptoe into some things, and as family we're just wanting to bulldoze because we see a need to get things done, but the patient or the client themselves is like, I don't really know if I'm ready for this.
Right, right. And how to move, I always think how to move all of that upstream so that it isn't this like mom fell for the 10th time and something has to happen in this kind of panicky way on everyone's part. How do you move that upstream before mom has started falling and said, gee, what can we put in place? Have we removed the rugs? Have we put in handrails? I mean, I'm being super basic, but like
No, you're right.
created an environment that keeps mom safe as long as possible where she lives now. And
Mm-hmm.
it's really interesting how I think we our reluctance to face mortality and our reluctance to talk about our aging bodies means that a lot of these conversations get put off until there's a crisis. And it's just makes it so much harder.
Again, which is why you and I do what we do. So we're trying to normalize that conversation early. So one of the things that my business partner and I offer is to be someone's healthcare advocate. Um, being actually named as the agent in the paperwork, so that but we don't want to be named as that unless they have really had those extensive conversations with us. So, that care planning or the best 3 months that that we do at the Conscious Dying Institute or Collective, we will do that with our clients before we will agree to be their agent, because we want to make sure, number one, that we know them front and back when something does happen. But number two, one of the things that we talk about is, of course, working towards completeness for if you were to die tomorrow, so we can work through all of those issues while the person is healthy and doing well. But also, what happens if I get dementia? And what do I want if I get dementia? Hey, it runs in my family. It's something I'm very concerned about. Me as a professional, have seen, of course, personalities change. And but if I would have known that my loved ones with dementia had wanted certain things, then I could be more confident in asking for those things for that person and not worrying, just like end of life. But it happens earlier with the dementia. It's the long goodbye, right? So it's got to start sooner. So if you're
Right.
talking with people about end of life issues and you say, okay, let's also include if you lose capacity, you still have a voice and you still have a choice.
And you've talked to us about that ahead of time so that there's information. I always say too, this isn't one conversation. This isn't this isn't like one quick thing. Okay, we got it all figured out. It's sort of over time. How do you keep bringing this forward? Well, Ashley, I appreciate your time so much. Let's rattle off a few resources again for people because we said some at the beginning, and I think this is such a great service that there are professionals, there are ways to get guidance and navigate the health system, whether you call it medical advocate or patient advocate or health advocate or health navigator or social worker or geriatric caregiver. They're all professionals who can help families understand what's happening and get through the system at a difficult time.
Mm-hmm. Yeah, so you can always call, like I said, the AAAD, the Agency on Aging and Disabilities. So look up in your state what that is.
AAAD, and say it again,
On Aging and Disabilities.
Agency of Aging and Disabilities. Great.
And at least that's what it is here in Tennessee. I don't know if that's a universal name or not. Honestly, I did not do my own research on that, but I did find that the eldercare.acl.gov is a central locator for your local office.
Terrific.
Mhm.
Eldercare.acl.gov.
Mhm. And
Fabulous.
then, and then just Google. I mean, you might have some great directories in your town that people can pay to be in, or that some nonprofits might put out. You can always ask your doctor if they have a directory, because usually those directories do find their way to hospitals and doctors' offices too. So there's a lot of ways to find resources.
Great. And how can people find out more about you specifically?
So working on getting my website done. I've got a private doula website that I'm converting over. So that's not done yet, but you can find me on Facebook under Life Journey Advisors.
Great. Love that name, Life Journey Advisors. That really, really sums up what you do. So Life Journey Advisors is Ashley Bright out of Tennessee, widely regarded and known as faculty for the Conscious Dying Collective. And of course, you can find out more about the work I do at bestlifebestdeath.com. Thanks for being a guest, Ashley.
Thanks, Diane. That was
And,
fun.
and thanks everyone for listening. Have a wonderful day.